Well, when it comes to surgery, there are lots of options available to improve our bodies. Well, if you're considering breast surgery, it's important to learn what type of procedure is really best for you. Board-certified plastic surgeon Dr. Patti Flint is here to explain all of our options. It's good to see you, Dr. Flint.
You as well, Terry. Thank you.
Well, first of all, when we think about breast surgery, the first thing that comes to mind, are implants.
Sure.
But there are other options if we want to, let's say, just look better.
Absolutely.
And what would they be?
Well, I think it's important to listen to patients' goals before you decide which procedure is best. Some women want more volume back, size. That comes with breast augmentation with implants. But other women have shape issues. After breastfeeding, their breasts have drooped or deflated, and it really requires an exam by a board-certified plastic surgeon to decide which procedure is going to provide you with the goals that you have.
Okay, so let's take a look at one of your patients here and tell us, when she came to you, what were her issues?
This gal really had what we call deflation. So she had 3 children, she's in her 30s. Her breasts really aren't droopy, but they're deflated. And if you look at the upper portion of her breast, she just has no tissue left there. So with augmentation alone, I was really able to recreate the type of fullness that she wanted that she had prior to childbearing. So augmentation alone was a good choice for her.
And when you use the word augmentation, what does that mean exactly?
Breast implants.
Breast implants, okay. And wow, I mean, and she looks fantastic in the after shot, and you know what, very natural too. I must point that out, because she's really looks very natural looking.
That's really my philosophy. I think natural looks better, so appropriate size implants are vitally important.
Absolutely. All right, let's take a look at the next patient here, because when somebody comes into you, they don't know exactly what they need. They think they might know what they need, but your job is really just to educate us as we come in and say, this is really what's best for your body.
Absolutely, and it's very important for me to do an exam, listen to the goals, and then help patients decide what's going to work best for them.
Okay. What did you do to this patient?
In this case, this woman really does have droopiness of her breast, but she's not at all bothered by it, and specifically did not want a lift. So we did exactly what she asked us to do, which is I put breast implants in her. She's completely happy with her result. However, her nipples are still a little low overall. Does not bother her one bit, so we didn't do a lift in her case.
Ah, okay. How do you know if you need a lift?
One of the easy things to do at home is a pencil test. If you place a pencil in the fold underneath your breast and it falls to the ground, you don't need a lift. On the other hand, if it's trapped under breast tissue, then you probably should consider a lift.
And in some cases, implants and a lift are necessary, and can you do both of those procedures at the same time?
It's a great procedure in properly selected patients. It allows us to provide more volume and to reposition the breast tissue and snug up the skin.
Okay, and I know a lot of women are looking at some of these before pictures and going, my goodness, that's me.
Sure.
Right, tell me about this patient.
This gal had a couple of kids. She not only lost volume but developed droopiness of her breast, and she was a great candidate for a combination of breast augmentation with implants and a lifting procedure.
How do you decide when it comes to implants, how do you decide where they go and what size of implant is really best for us?
This is one of my favorite topics because it's so important to educate patients on why the appropriate size for them is important. Really, you have to do measurements on patients and assess the quality of their tissues before you can guide them to appropriate implant size.
I see. And I think that it would be, I think we all just want to look natural. We want to look better, but we still want to look natural.
That's my favorite thing to do. I think oversized implants come with higher complication rates, and you really do need to stick with what fits your body, and a board-certified plastic surgeon can guide you well in that regard.
All right. Excellent information as always. Now, let me tell you about a special offer from Dr. Flint. If you mention Sonoran Living Live when you book your consultation with her, you'll receive $100 credit towards your surgery. Dr. Flint has 2 locations to choose from, one in Old Town Scottsdale, one in Mesa. The phone number 480-945-3300. You can also learn more by looking up pattiflintmd.com.